Okay guys, identifying a case of TB on the exam is not rocket science, okay? The clues will be obvious and they will lend themselves to you in order to make you at least suspicious that this might be a case of tuberculosis. The examiners love to test you on the approach itself. This is where things get tricky. So the elusive thing is when the examiner is asking you about how are you going to approach those patients, okay? What is the first or the initial test? How are you going to proceed after that? So I have made this simple yet I think very sufficient algorithm. Uh, as far as the step 2 exam is concerned with the diagnosis of tuberculosis, this will be sufficient and you will solve most if not all the questions. Anyway, let's start. So the initial test you are going to order is going to be with the screening method, okay? So let's start with the screening methods. So the screening methods are either a blood test or a serum based test or a skin test, okay? The serum or blood-based test is interferon gamma release assay. This test is the preferred test for most patients, okay? You are going to order this test for most patients, and in particular, this is very useful in patients who took the BCG vaccine. Why? Because it has no false positives in those patients. You see, this is a quantifying test. It quantifies the T cell response. It is based or dependent on the levels of interferon gamma in the serum. So it's a serum marker. Interferon gamma, hopefully you still remember from step 1 that it is a very important substance released by T helper cells and it is essential in granuloma formation. Hence its utilization in TB. Okay, so this is a serum marker. Okay, that is why it is preferred in most patients. The other test, it is somewhat, you can say, a provocative test. You are not only measuring, you are doing something. You will inject the patient with a purified protein derivative, basically part of the mycobacterium, and you will measure the immune response indirectly via measuring the induration area. You will inject the patient with this purified protein derivative subcutaneously, and you will measure the area after 2 to 3 days. Okay, very important to understand that you will measure the induration area, not the erythema. Okay, so it goes without saying, you will understand that this type of test might come up falsely positive in patients who took the BCG vaccine, because the same PPD it's going to be part of the BCG vaccine. So the BCG vaccine, for those who do not know, is basically a different strain of mycobacteria. It is an attenuated Mycobacterium bovis, and it is not used in the US or Europe, at least for the general population. There are some niche indications. I'm not going to go over this. It is not used for the general population because it has been reported that there were some cases of TB in patients who took those vaccines. Okay, so this is the initial test. Well, when either of these tests comes positive, then you know that you have a case of TB. Whether it is an active or a latent case, these tests do not differentiate. Okay, you are simply understanding if this patient, does he have TB or not. Okay, if you want to know if it is a case of TB which is an active case or a latent case, then you will do a chest x-ray. We all know the chest x-ray findings. I'm not going to go over these, but in case the chest x-ray findings were there, they were present, there are pathognomic, let's say, chest x-ray findings, then this is a case of active TB. Okay, in latent TB, you will have the initial screening test positive, but there are no chest x-ray findings. Okay, there are no findings of TB in this patient. In this case, the test is going to be negative, so normal chest x-ray. Those patients have TB, but it is a latent TB. Okay, what are you going to do in either of these? So in patients who also have positive chest x-ray findings, you are immediately going to start treating them for active TB, okay, while waiting for confirmation. The confirmation is via these two tests, okay. The gold standard is the most important one, is the sputum culture, okay. It's going to take about 3 to 6 weeks to get the results, okay. You know, mycobacteria grow slowly in their cultures, so it takes a while. That is why you are going to start the the antibiotic regimen immediately. You will not wait for the confirmation, okay. While waiting, you are going to treat them for active TB. In patients who are negative for the X-ray findings, you are going to do a sputum microscopy and a sputum culture, okay. You are going to do the confirmation tests, and you will wait, okay. You are not going to initiate the treatment. You will wait to exclude active TB, okay. You need to exclude that this patient has active TB. Then you are going to start with the latent TB regimen, okay. So this is the algorithm in general. I'm gonna drop a link for the whole algorithm in the description box. You can see the other details, but in general, this is the most important part. First, you are going to do a screening method, okay? A screening test, either a blood test or a skin test. If it came positive, this is TB. Then you want to know, is it a latent or an active case of TB? You will do chest x-ray. If it came positive, immediately start treating for active TB while waiting for the confirmation via the gold standard is sputum culture, okay. If it came negative, the chest x-ray, this is a case of latent TB, okay. So you will wait for the confirmation, okay, or actually you will wait, first must exclude that it is an active case of TB, then you will start the regimen for latent TB, okay. I'm not gonna go over the regimens themselves for the active and the latent. These are out of the scope of this video.